We all know the best defense against breast cancer is early detection. Your radiologist might see something in your breast exam that looks suspicious. To find out more, we perform a breast biopsy. That means we take a sample of breast tissue and have it examined in a pathology lab. Most breast biopsies turn out to be benign or non-cancerous. In the past, a biopsy always meant open surgery, with all its risks and anxiety. Today's breast biopsy is minimally invasive, using image guidance to find the area of interest, and a needle to take a small sample of tissue. This means a more comfortable procedure and a faster recovery. Hologic 3D breast biopsy is an advanced approach, offering maximum precision, a shorter procedure time, and lower total X-ray exposure. Of course, it's okay to be nervous about any medical procedure, but it's really not quite as scary as it sounds, and it helps to know ahead of time what's going to happen. First, your technologist will get you into position, either seated or lying on your side. She'll carefully compress your breast, just as she would for a mammogram. The 3D system scans your breast in just a few seconds, producing the images needed to pinpoint the exact location for the tissue sample. The physician scrolls through the 3D scan and marks the target area on the screen. This gives the system a set of numbers to precisely position the biopsy device. Once the biopsy device is perfectly positioned, your physician will clean and numb your breast, and then make a small incision. This is when it's important to hold very still. When the physician triggers the device, you'll hear a noise, and you may feel some pressure. This advances the tip of the needle to the exact point where they want to make a sample. They take another image to be sure they've reached the area of interest. Now they're ready to take the tissue sample. The biopsy system uses vacuum pressure to remove the sample, flushing the area with fluid at the same time. They will take a few samples to make sure they have enough tissue for diagnosis. This usually takes less than a minute. Finally, the physician places a tiny marker at the spot where they took the sample. The marker will be visible in any future imaging to show exactly where this biopsy came from. When the procedure is finished, they bandage your incision and apply pressure for 5 to 10 minutes. Then you will have a post-biopsy mammogram. Normally, the whole procedure should take about 45 minutes. Most women are able to get right back to their normal lives the same day. It's normal to feel some discomfort. There's a tiny nick in your skin that will heal in a few days. Your physician will provide post-procedure instructions. If you develop redness, tenderness, or swelling, or any unusual symptoms, be sure to let your doctor or nurse know about it. Your doctor will contact you to tell you what the lab work indicates and whether any more procedures need to be done. Early detection is the best weapon against breast cancer. A longer, better life is something every woman deserves.